Several years, probably about 2004, 2005, 5 years before I knew there was such a thing as a Council on Communications and Media, I was flipping through Pediatrics and I read an article that I thought was brilliant. And it looked at something that was relevant to me, which is how kids my age were using media, what it was doing to their ability to learn and behave. And it was written by two guys named Christakis and Zimmerman. And I thought, wouldn't it be cool to meet either of those guys one day? I would just love to talk to them and have a conversation. And later I found myself serving on the executive committee with another one of my heroes, Dr. Dimitri Christakis. Dr. Christakis is a professor of pediatrics and director of the Child Health Institute at the University of Washington, a pediatrician at Children's Hospital in Seattle. Dr. Christakis is the author of over 100 original research articles focusing on the effects of media on child health and development, and as far as I know, the only academic article to look at SpongeBob. Versus Caillou, by the way. He is a member of the AAP Council on Communications and Media and is a member of the Washington chapter of the AAP. Dr. Christakis is a co-author of the new AAP policy statement that we published today, Media and Young Minds. Please welcome Dr. Dimitri Christakis.
Thank you, David. You're also one of my heroes. You've taught me so much about gentility. It's just been phenomenal to be associated with you. Okay. I have no conflicts of interest to disclose. Those of us under the age of 30, and it's funny, probably 10 years from now, there won't be digital immigrants at this conference anymore, but most of us came to technology later in life and have a fair amount of frustration dealing with it as a result. And that's to be contrasted with the children that we care for, the children that we have who are really digital natives and are born immersed into this intense experience with media from a very, very young age, as Michael alluded to. And one of the generational challenges we have, and one of the generational challenges we face as pediatricians, is that we're advising digital immigrants on how to raise digital natives. So there is a generational challenge. Now, these differences manifest themselves in many ways. So those of us that are digital immigrants, which I think is everybody here, we tend to think in terms of single task, sequential thinking. We tend to rely on text, and we use limited references. And that's to be dramatically contrasted with the way our children and our patients operate. In fact, it's often a source of enduring frustration for us as parents that they just don't approach things the way we do, and we try to force them to do it the way we did it as children. So I'm going to focus on early childhood today. I'm going to focus my talk on three concurrent phenomenon that occur early in childhood. The first is brain growth. The second is executive function development. And the third, which is what this plenary is focused on, is media exposure. But I want to give a little background first. So starting first with brain growth. Now here is a human infant. You're all familiar with this creature. This is a roundworm you're probably not familiar with, called C. elegans. They seem very, very different, and in fact, they are. Now, what's interesting is that the human infant has 300 billion neurons, and C. elegans has 302 neurons. But there's some similarities. The human infant's brain, in fact, the entire human infant's body, everything about them, is set up by 20,000 protein coding genes. I didn't do that. And that's exactly the same number that the roundworm has, believe it or not. And more to the point now, because we know so much about the roundworm, every human disease that has a genetic basis can also be found to have the same genetic basis in that roundworm. So as different as these creatures are, their brains, as different as they are in magnitude, it's not the genetic code that makes it different. It's the environment in which that brain develops. Very, very different. And in fact, we see this if we look at newborn brains. So the typical human newborn brain weighs 333 grams at birth, and it triples in size in the first 2 years of life. Not true of the roundworm's brain, which is basically fully formed and doesn't change after birth. And this brain growth is dramatic early in life. If you look at it here on this graph, you'll see just how steep the rise is. And it's not complete until late adolescence, early adulthood, when the prefrontal cortex is the last part to develop. And you can find yourselves over on the right there and see why you had such a hard time finding this room today. But the important part is just how steep it is early and how important that early brain growth is to lifetime function. Now I show you here the breathing pattern of a one-day-old infant listening to music. And you can see here, I don't have a pointer, but that Mozart is playing, and you can see a certain respiratory rate. And then Stravinsky comes on, and then Mozart. Now, I show you this not to present an infantile critique of classical music, although some of you who know classical music might have a hypothesis for why Stravinsky did this to this poor baby's breathing. I show you this to demonstrate that as early as 1 day of life, there's a discernible physiological reaction to what babies are hearing. That's how attuned they are to their environment. That's how profound an effect it's already having on them. Now, we know that the brain develops from back to front, and I'm going to have a hard time seeing these slides. I'm used to having a screen here. My presbyopia is, but you can see that it develops from back to front. So at birth, these are the functions that are already present. Beginning at about 4 months of age, we have sensory and motor integration, inhibition of primitive reflexes. You all are probably familiar about this in your work. Beginning at about 10 to 12 months, the limbic system starts to develop, and that's what regulates emotions. And that's why we don't think of infants, little infants, as having temper tantrums, but starting in early toddlerhood, they can have really, really good ones as their limbic system begins to develop and they don't have a lot of exertional control over it. And then starting later, we have speech and language processing. And then finally, the last part of the brain to develop is the prefrontal cortex that I was talking about before, which is really where executive function resides. And that's what I want to talk about next, because executive function is, I think, incredibly important, and I hope I'll impress that on you. So those of you that aren't familiar with executive function, it has 3 components. The first is self-control, which is the ability to stay focused on something and not be distracted. The second is working memory, which is the ability of a child or any human to keep something in their mind and access it later. And the third is cognitive flexibility, which is the ability to apply something that you learn in one setting in another setting. Now, all 3 of these core functions are incredibly important. But in my opinion, and I'll hopefully impress that on you, of all 3 of these, self-control is the most important. The ability to stay focused, the ability to not be distracted, is the most important function that the brain has. To demonstrate this, now there have been many studies, but I'll tell you this is a seminal one, published in 2011. It used the Dunedin longitudinal cohort. Some of you may be familiar with this. It's a large birth cohort. It's probably one of the most famous cohort studies ever published. There have been thousands of research articles using it. And they followed children from birth to 30 years of age. They have excellent follow-up. And what they did was they measured, among other things, child self-control as preschoolers, measured here in quintiles from low to high. So how good was their self-control when they were children, before the age of 5? And then they followed them because they have data all the way into adulthood. And I show you here substance dependence, poor physical health, socioeconomic status. The slide would have been too busy if I put the other things on it, but every single thing you could imagine, college graduation, marital rates, substance abuse, everything followed this exact same pattern. Better self-control in early childhood, better outcomes later in life. I also want to point out, and I think this is very important because for most of us, we think of self-control and ability to stay focused in the context of a clinical diagnosis of ADHD, which we treat as a dichotomous variable. We derive a clinical cutoff and we say, this child has ADHD, we'll medicate you, we'll make special accommodations at school, but you don't see any evidence of a threshold here. It's a continuous variable. So really, as a society and as practitioners, it's our job to try to help children maximize their ability to develop that self-control early in life and not treat it as if it's something that there's either a clinical problem with it or it's unimportant. Now, I mentioned brain growth growing early in childhood, and so does executive function. You'll see how steep the rise is here early. So again, this early period is really, really important for the development of a skill, of a capacity that has lifelong implications. All right, having set the stage now, I want to switch to media exposure during this early childhood. There are two ways, really, I think, that the media affect early environment, and I appreciate Michael's using the word media as being an environmental exposure, because that's really what it is. The first is through overstimulation, and the second is through decreased joint attention. Now, many years ago, some of you have probably heard me say this before, we had what we described as the overstimulation hypothesis. This is actually what I think David was referring to. And that was that prolonged exposure to fast-paced media during this critical period of brain development, where brain growth was being spurred, where executive functioning was developing, would precondition the mind, the developing mind, to expect a high level of input, that this is what's normal. And that would lead to inattention in later life. You watch enough Baby Einstein Day on the Farm as a baby, and then when you go to a farm as school-ager, everything is too slow. It doesn't happen fast enough. This is so boring. We've shown that in several studies that we've done. What we found was that the more television children watched before the age of 3, the more likely they were to have attentional problems later in life. And notice that I don't say clinical diagnosis of ADHD, because I don't believe it's the relevant outcome here. We also found that the more cognitive stimulation children received before the age of 3, the less likely they were to have attentional problems later in life. We measured cognitive stimulation by how often parents read to their children, how often they sing to them, how often they take them to museums. And to put some numbers on this, each hour of TV watched before the age of 3 was associated with a 10% increased risk of attentional problems at school age. Each hour of cognitive stimulation was associated with a 20% decreased risk of attentional problems. So a child who watched 2 hours of television before the age of 3 would be 20% more likely to have attentional problems at school age compared to a child who watched none. Now I want to switch to talking about joint attention. I think most of you know what that is, but I'll put a little bit of clinical parameters around it. So starting at about 4 to 6 months of age, babies' attention can be directed at something. So you can point to something, they'll look at it, and they'll instinctively turn back and look at you, implicitly asking, what is that? Tell me something about it. And there'll be an exchange. Beginning at 10 to 12 months of age, like the baby in the upper right-hand corner, babies, young toddlers, can direct parental attention to something, directing you to look at it, and then you look back at each other and you have an exchange. This happens hundreds of times a day, ideally. Most parents, most caregivers aren't even aware of it. And it's incredibly important not just to cognitive development, but to social development as well. So some years ago, we wanted to study the effects of media. This was before distracted parenting existed as a diagnosis. And we used something called the Lena, which is a little digital language processor, which is worn on a vest and records everything that a child hears and everything that they say. And then there's a decoder that Lena uses where it can actually decode it into adult words, conversational turns, child words, and television. And what we did was what's called conditional regression. We compared times when a child could hear a TV to times when they could not, and looked to see how many adult words they were hearing. And here's what we found. Each hour of audible TV, when a child was hearing television, again, this was before the ages of iPads, which we'll get to in a minute, resulted in them hearing 656 fewer adult female words and 200 fewer adult male words. Now, how many words does a typical adult female say in an hour? No one wants to hazard a guess. She says 700. So there's about a 90% displacement. When the baby's hearing a television, there's a 90% reduction in the number of words she would otherwise be hearing. Now, how many words does a typical adult male say in an hour? So I can tell you, I've presented these data all around the world, and it's a universal phenomenon that people have bought in, including women, because I heard a lot of the women guessing this way, that men talk less than women. The typical adult male says 705 words an hour, 5 words more, not statistically significantly different. So men and women talk the same amount. It doesn't mean they listen to each other, but they utter the same number of words. The reason you're seeing this difference here is not because men talk less than women, but men talk to babies less than women talk to babies. And so there's actually a 95% displacement amongst the number of adult male words that a baby would hear, but it's because men don't talk to babies as much as women do. Now, I mentioned this was around television, but we do have this phenomenon, and Michael already alluded to it now, of distracted parenting. And if you look here, there's so many examples, I think we're all familiar with them, but one of the ones that strikes me is the one on the bottom right, where someone is taking a selfie at the expense of actually having that joint attention that the child wants. That's what's being displaced at that moment. This is a moment of this baby doesn't care about the selfie, but they're really eager to get their parents' attention. Okay, so I want to summarize this section by saying that traditional media, especially fast-paced media, should continue to be discouraged under the age of 2. And David mentioned that the new policy statement is coming out, and I'm going to summarize at the end, but I want to reemphasize this point. This is not, certainly me and not the policy is going to be stated as encouraging media use under the age of 2. Now, this is an important date, which now is fading into the background, because most of what we talk about, most of what we think about was traditional passive media. But on this date was the rollout of the iPad that we're now very familiar with. And it's really, I think, a seminal change in the media landscape of children. And I usually I summarize it this way. What is the one thing that a child never says or never thinks if they're pre-verbal when they're engaging with traditional passive media? And the answer is, I did it. Because, of course, they do nothing. It's an entirely passive experience, the process of just sitting and watching. But that's very different. It certainly can be very different in the context of iPad use. So one of the questions becomes, when we think about these interactive technologies, are they more like traditional passive media, or are they more like sort of what we think of as traditional toys? It's an ongoing area of research. We're looking at it actively now. But I want to sort of summarize dimensionality that you might think about when you think about the differences between these. So the first is the toy or is the object reactive? Does it do something in response to something you do? Well, clearly, some traditional toys are. iPads clearly can be. Traditional television is not. Is it interactive? Does it react to you independent of what you do, or differently depending on what you do? Clearly, touchscreen technologies do that, and many traditional toys, most traditional toys don't, and television doesn't either. Is it tailorable? Does the toy itself become different depending on who the child is or how the child is engaging with it? And clearly, touchscreens have that capacity. Is it progressive? Does it move from one spot to another? Does it become different as you play with it more? Clearly, touchscreens have that capacity and these other ones don't. Can it promote joint attention? We talked about how important joint attention is. Well, television does not. It robs it. Traditional toys certainly can, and interactive screens possibly could. Is it portable? And then, of course, is it three-dimensional? Now, before you take away from this that I said iPads are the greatest thing in the world, I'll point out that the simple act of reading to a child does all of these things at a fraction of the cost. So it's not at all that iPads are some new messianic delivery system that will make children better, smarter, more musical. But they do have to be looked at differently than traditional media, and not come at the expense of this age. I did not know that Perry was going to be honored today. I swear, this was in here before. But not come at the expense of something that has been shown for so many years to be such a good thing. And I want to just show you some things, some kids playing with these things. It makes you have to realize that this is a different landscape. It's a different world. And even the two-dimensionality of a device that we've previously critiqued for that is also being challenged. Now, this is from the Common Sense Media study, just to show you how prevalent these things are. These are the percent of children under 2 that have ever used a mobile device. You'll see here that it's tripled in just 2 years, and these data now are a few years old. But it's an enormous amount of kids under the age of 2 are using mobile devices. Unfortunately, Common Sense Media didn't ask what percentage of kids in that age group own their own mobile device, but a group in Philadelphia did. Now, keep in mind, this is in a low-income Philadelphia clinic. And focus just here on the percentage of children who own a tablet. And look, that it goes from 10% under the age of 1 to 54% by the age of 3. And this is it's admittedly one clinic, but it's a low-income clinic. You would, if anything, expect it would underrepresent what's happening elsewhere. So enormous prevalence of these things at very, very young ages. We know very little about the effects of these things. Science is lagging. But I want to highlight one app, and I'm always asked to recommend apps, and I always shy away from it because I hardly know the entire landscape, and most of them don't have a rigorous scientific basis. This is an exception, and I would urge you actually to take this back to your clinics and recommend it. It's an app called Bedtime Math. It's one of the very few things that has been rigorously studied. And the way the Bedtime Math app works is that it downloads a story every day onto your device, whether it's an iPad or a phone, and it's a very simple story that has some math embedded in it. And then you read the story with your child, and then you choose if you want to do the easy, the medium, or the hard problem. And you work through the problem together, and it gives you the answer. Now, bedtime math has actually been studied in first graders in a large randomized controlled trial in Chicago in 32 public schools, where they randomized them to either the math app or a reading app, so it was a very well-designed attentional control study. And they looked at math competency over the course of the year. And what they found was that the bedtime math actually really worked. It improved math skills overall compared to the reading app. And it had a much larger effect, if you look here, in parents who self-reported that they were anxious about math, that they felt themselves not well qualified to do math with their kids. Now, there's something that's very important about the bedtime math app, though, that shouldn't be lost on any of us. Because what it is it's not an app that you give to a child and you walk away. It's actually an app that's specifically designed to create joint attention, to create a platform for parents and children to do something together that they might not otherwise do, not have the right structure, not have the right tools, not have the right competencies. And this, to me, is the sweet spot. This is where we need to go, I think, to take full advantage of these interactive technologies and make sure not only that they're not harmful, but they actually work at a population level. They help parents interact with their children in constructive ways. I give you an example of math, but it could be any number of other things. Now, this is first graders, and so again, in the interest of full disclosure with respect to evidence, it's been rigorously studied in first grade kids, and I would totally urge you to recommend it to your patients, no questions asked. Okay, I want to show you now, this is research we're doing right now, trying to study exactly the benefits of interactivity versus passive media use in young children. So this is Monster Words. The Monster Words app was developed by a really amazing graduate student of mine, Alexis Hineker, who should get all of the credit for this. And the way this works is children are shown monsters that have nonsense names. They're shown them either in a passive experience or an interactive experience, and then we quiz them to see which way they've learned it better. So you're going to first see the interactive experience, and then you'll see the passive one. And I hope we're ready with the audio. Okay. Can you turn it up?
The glorp is holding a cup. Touch the glorp. A glorp says meow.
What? He said meow.
So I'm sorry the audio is not working well, but he's being prompted, the glorp is doing various things, and he's being prompted to touch the glorp each time.
The glorp is climbing.
Climb.
Touch the glorp.
Try again.
A glorp likes eating bananas.
He must eat the yum.
Right, we'll watch this one. This is a blick.
So now this is the passive one, and watch what happens here, even without prompting. He's now just going to watch, and he actually moves back. Now he's just going to watch a different monster with a different word. And because you can't hear it, I'm going to skip through it. But you get the idea that there are two different ways of trying to learn nonsense words. Now, what I show you here is how the receptive language is affected by both interactive and passive media. And the point of this slide, I should point out, these were kids ages 18 months to 3 years. They were a pretty homogeneous group because we recruited from a high-income population. So these kids are all children of very well-educated, high-income parents. But look at the dramatic differences in how well they acquire language in either condition by age. So look at the spreads there. This confirms something we all know, right? We tend to make recommendations based on age, but children's developmental trajectories are phenomenally different at this early age. So there are kids as young here as 18 months that are doing incredibly well, and there are kids at 3 that aren't doing well. And the challenge we have when we make any age-based recommendation is that we sort of assume that these kids are going to be about the same at that age, and that's clearly not the case. So we also have to think very much about treating the child in the context of the family and not just focus on age alone. But, oh, I stopped myself. I can tell you that what we have found in our preliminary studies, results, is that interactivity enhances engagement and learning, that the kids who are in the interactive group do better, do engage a screen more, do seem to learn better. All right, and what have others shown? Well, infants don't transfer knowledge from apps to the real world very well. Very young infants, even though they'll watch something, they don't tend to transfer that knowledge at all to the real world they live in. Beginning at about 15 months of age, they can start to do that with some parental reteach, so they won't do it independently, but with a parent helping to reteach what they learned, they can start to do it. At about 16 months of age, infants can attend and engage in joint attention using video chat, especially with parental support. And at about 24 months of age, they can actually start to learn words from video chat. But I should point out that these are small studies, mostly in laboratory studies, and there haven't been very many of them. But this is what the state of the science is right now. I want to point out one other phenomenon I think is really important we have to think about when we think about interactive media use in young children, and that is to focus on the dopamine reward pathway. So the dopamine reward pathway, very briefly, it starts with a signal from the VTA in the base of the brain, sends a signal to the nucleus accumbens, which is experienced as pleasure, and the nucleus accumbens sends a signal to the prefrontal cortex that says, I like that, that was good, do that again, get more of that. Now, I talked about how the experience with an app gives the child a sense that they did it. Nothing is more pleasurable to a child than that sensation. What is this child going to do with these toys? They will assuredly throw them off the high chair and delight in it. They'll then re-delight in the fact that the caregiver will come and put it back up. And that loop will go on until this child is 15 if you don't stop it. That sensation of I did it is enormously pleasurable for young children. And that is the one concern I do have about these interactive apps, that it really can become compulsive. Michael talked about internet addiction or gaming problems in teenagers. I actually think it starts younger than that. It certainly can start younger than that, and we have to be cognizant of that risk because they are so susceptible, especially given their emerging early cognition. All right, so in conclusion, many of you probably already know this, but I want to sort of put some context around the Media and Young Minds policy statement, which was released today, and Jenny Radesky is the lead author. I think she was here earlier. So the rationale for this is that the screens have changed and the recommendations have to be updated accordingly. And we still applied the first do no harm principle, so I want to assure you that it's our considered opinion, reviewing all of the literature, using our own best clinical intuition, that what we're recommending will not be harmful to children. What is unchanged in the current recommendation is that media before age 2 is still discouraged. And the press has frequently misrepresented this. It is not our position nor the Academy's position that we should be encouraging media before the age of 2. Infants need laps more than apps, and we have to communicate that to our families very, very loudly, that there is no better early experience than the process of being held close and engaged one-on-one. What is new? Video chatting is okay. This has come up before. I think it was one of the things that made the old policy guideline fairly stale. As Michael said, we treat screens the same, and that would mean that playing Grand Theft Auto is the same as Skyping with your grandmother. That's clearly silly. Starting at 18 to 24 months of age, high-quality, interactive, slow-paced media with your child is okay, but it's not to be encouraged. It's okay. And we should avoid media as a calming strategy. I think it's very important. Children are building self-regulation skills early on, and we need to not get them to be dependent on devices as a way of emotion coaching. And the other most salient thing that I suspect is not going to be popular with some of your parents and maybe even with some of you, is that we have reduced the recommended time, this is for young children, these are for children under the age of 5, to 1 hour a day, down from 2. Some may ask why. The simple truth is that children this age are awake about 12 hours a day on average. and think about how that time should be spent. As an academy, we were allowing, in good conscience, that 30%, 25% of their time be spent on a screen. That's too much. It really is too much. And when you consider that kids this age won't spend that much time with any other toy, it's clear that there's something alluring about this medium that's excessive. And finally, no screen time 1 hour before bed. Okay, and the final thing I want to point out is that all of these recommendations just talk about time, and I think the real challenge we have to face with our parents is how context really matters. If you think about just the amount of time or even the content that they're viewing, you miss that there's something fundamentally different from this experience to this experience to these kinds of experiences and ideally to these. So I think we really have to make sure we emphasize with our parents that the whole experience needs to be taken into account. Thank you very much.